Congratulations, you're having a baby soon. You should be excited. You're probably nervous and you probably aren't sure exactly what to expect when you turn from expecting to actually parenting. Well, with over 25 years of pediatric experience, let's dial down some of that anxiety by sharing answers to questions that all new expecting parents should have or usually do have. Number one, should you, as a first-time parent, meet the pediatrician before birth? Emphatic yes. When you're looking for a pediatrician, you will entrust the care of your child for the next 18 or so years. A bunch of 5-star reviews or recommendations from friends are helpful, but actually meeting, sitting down in the office can seal the deal. There's no better time to meet the pediatrician than those first few weeks or months before the baby is born. At ActiveKidMD, we welcome soon-to-be parents to schedule a no-cost meet us visit in our office, and I know many offices offer similar opportunities. It's so much easier to park your car, find the office, walk in, and take in the office vibe without having to bring in a car seat stroller, a baby bag, and that sleeping or crying infant. You can get a good sense at that first visit whether the office is a good fit. And what are you thinking about? You're thinking, is it easy to access? Is it close to our home and work? And do the pediatricians and staff really make the effort to get to know you? This is a good time before you have your baby to make those connections. In the first meeting we have with expecting parents, we will discuss what to expect in those first exciting months after birth. That includes reviewing basic newborn care, discussing how our office works, and give you a chance to meet familiar faces to greet your newborn when they arrive. We also do the logistical work of confirming insurance acceptance. That's not the fun part. Now, other questions you should be asking us is to tell us about your practice and child care philosophies. And at ActiveKidMD, we pride ourselves on providing individualized, comprehensive care that acknowledges the best course of action may be different for every family. We try not to dictate treatment plans. We like to go over options, alternatives, risk benefits so that we can all confidently share in the decision-making process. We also are team players. We're not hesitant to communicate with our colleagues, to collaborate in the care of your family. You may ask the pediatrician, do you have any subspecialty areas? And at ActiveKidMD, you're not just getting a board-certified pediatrician, you're also getting board-certified sports medicine specialist who can work with your active child from birth through the young adult years. You know, kids grow pretty fast, and before you know it, you're going from the crib to being a regular on the field, the court, or the dance floor. So a pediatrician who has a specialized skill set in sports medicine will help connect with your older child and offer ongoing unique chance to talk about fitness, nutrition, and reduction of injuries. Now let's move back to that newborn phase. I get asked a lot, what should I have in my newborn baby bag? It really doesn't have to have many medicines. Yeah, it probably needs to have diapers, burp cloths, and plenty of outfits, but again, the medical stuff is probably limited. You may get a blue or green bulb syringe at delivery. Yes, keep that with you in your bag. Very helpful to suction your baby's nose and mouth if they have a congestion with a cold. And good old saline, good old salt water can be used with a bulb to help suck out that snot and congestion. How do you communicate with the pediatrician both during office hours and when it is closed? Let's be honest, not everything happens between 9 a.m. and 5 p.m. Monday through Friday. What happens when you need to communicate with your pediatricians after those times? Who's going to answer your phone call? Is there a phone tree? Do you have to leave a voicemail? And what happens after hours on weekends? Are you categorically, automatically referred to the urgent care or emergency room? Or are there ways to communicate even in office or through telemedicine with your pediatrician after hours? When you call ActiveKidMD during or after regular hours, you're greeted by a human voice, and often one that's been with us for many years. We try to respond back to urgent messages within an hour or two, and we often will offer a scheduled office or telemedicine visit to follow up on your call. If the office is closed, one of our doctors takes calls for most awake hours, and we have backup through pediatric specialty nurses at Rady Children's Hospital of Orange County. We offer telemedicine office appointments both during and after regular hours. This helped a lot of families reduce the need for urgent care or emergency room visits. And then we have a wonderful portal message access system, and we try our best to reply within 24 to 48 hours for non-urgent matters. Yesterday I was in the office seeing patients, got a message through the portal, seemed urgent, we got that family in within 2 hours. So we try to do our best to ask our patients to contact us first, because we can try to address your needs and reduce the need of urgent care or emergency room visits. Speaking of visits, you may ask, can I schedule same-day appointments with familiar doctors if I have concerns about my newborn, if my newborn is sick? Yes, indeed. Hey, we know being a first-time parent can be challenging. When you call with a concern, we try to help with offering same-day appointments or same week, depending on the concern. We can do that in office or through telemedicine, and we try to keep appointment slots for those same-day appointments, and we try to be creative to get sick kids in to be seen. Again, I want to reduce the need for urgent care or emergency room visits. Now, let's talk about car seats. I'm going to give you a little tip. Having twin boys and putting car seats in, I'm a little bit of a pro. Take the time to put the car seat and the base in all of your cars before the baby comes. No matter how many do-it-yourself videos you watch, they're a challenge, let's be honest. You try to do it with a baby right next to you who's sleeping or crying, it's extra stress. So take the time before the baby comes to work with your bases and car seats, and remember, AAA really does help you out, as do local police departments. This will get you more ready for your baby's birth and make you a lot less concerned. When will you first put your baby in that car seat and come to our office for the first visit? Again, be prepared to see us for the first in-office visit 3 to 5 days after the baby is born. When they come in, we want to check the weight. Now, I'm going to give you, spoiler alert, your baby's probably going to lose weight in that first visit. That's okay and normal. Our job is to make sure it's not excessive weight loss, and this will happen whether your baby is breastfed and or formula fed. So we're going to check weight at that first visit. So putting in time to ask questions and visit the office well in your last trimester will be a value add. It'll reduce the stress, let you make a commitment and a connection with your pediatrician, and find the best doctor in practice for your baby. And we certainly hope that ActiveKidMD can be part of that process. Again, we're a smaller office. We try to make nice connections with families, and we have availability same day, same week, in office and telemedicine appointments.